Pregnancy. Pregnancy covers all the events that occur from fertilization until the infant is born. So this image shows you the development from an egg to a zygote. The oocyte, which we know as the egg, right here, the one that has been released at the time of ovulation, is actually viable for 12 to 24 hours only. For fertilization to occur, coitus, also known as intercourse, must occur no more than 2 days before ovulation or 24 hours after ovulation. We did say in our previous chapter that the sperm can be deposited 5 days before ovulation and still be able to um, fertilize an egg. So fertilization is when the sperm chromosomes combine with those of the secondary oocyte to form the fertilized egg, which we now call as the zygote. Okay. So to accomplish fertilization, the sperm that has been ejaculated will actually leak out of the vagina immediately after deposition. Some that make it through the vagina will be destroyed by the acidic vaginal environment. So many fail to make it through the cervix. And those sperms that make it through the cervix can actually be destroyed in the uterine cavity by phagocytes. That means of the millions that have been deposited into the vagina, only 100 to a few thousand will make it to the fallopian tube. So what happens to those few strong swimmers? Well, this is an overwhelming slide, but just to summarize, the few that have reached the egg uh, will actually need to get through a few more hurdles, including the layer of follicular cells, the corona radiata, the zona pellucida. So all the sperms are helping each other in destroying all that force field that surrounds the egg. Now, this is the one sperm that actually made it through. So that sperm, despite being held by all the other sperms, as soon as it enters the oocyte cytoplasm, it triggers a reaction that will cause the zona pellucida, which is this, to harden, blocking the other sperms from getting in. So there's no possibility of many sperms fertilizing one egg. We call that the block of polyspermy. Again, the first sperm who gets there will cause the zona pellucida to harden and no more sperm can. Okay. So here is a summary of the fertilized egg right here, which is now called the zygote. Okay. So that zygote was the one who was able to penetrate the zona pellucida. In 2 days, it becomes a four-cell stage. And then in another 3 days, you have a morula, which is a solid ball of blastomeres. And then you have your early blastocysts. And then you have your late blastocyst, which is the one that will implant right here in the endometrial lining of the uterus. So sometimes, an embryo or an egg will split into two, or even three, or even four. And that's not because of more than one sperm fertilizing it. That's because one embryo splits and become two or three or four. So if this fertilized embryo will split just before implanting, you will have twins that will have separate placenta and separate amniotic sac. If the embryo implants in the womb and then splits, then you will have one placenta and two separate inner sacs. Now, if the embryo implants in the womb and will split a little bit later, that's when you have twins that share a placenta and an inner sac. So that is what we call as a monozygotic twin, one zygote. Then we also have dizygotic twins when two eggs or three eggs will be released at the time of ovulation, two eggs, and that means that two separate sperms will also fertilize those eggs. Okay? So that's when you have your fraternal twins compared to your identical twins in monozygote. So now you have here your implanted blastocyst. Um, so the embryo has eroded the endometrium. The endometrium are now getting invited basically towards the blastocyst. In 12 days, you now have complete implantation. You have what we call as the trophoblastic tissue right here, which will eventually become your placenta. In 16 days, you could see that the embryo now has distinct germ layers. You could see the ectoderm, the mesoderm, and the endoderm very clearly, which are the origins of all our tissues, of all our cells. So in that tissue, there is the secretion of the HCG. The tissue is the trophoblast tissue. And the HCG is what we also call as the pregnancy hormone. In fact, this is the one that we test when we do a pregnancy test. It's a misnomer because it's not only released during pregnancy. Sometimes individuals with tumors can produce HCG. You can even have a male with testicular cancer that can produce HCG. So this shows you the height of HCG production, and it's possible to have a negative pregnancy test later on in the pregnancy. You can see how low the HCG is in the ninth month of pregnancy. But at that time, the estrogen and progesterone are much higher. So the HCG also, as it's being secreted by the developing trophoblast, it will start prompting the corpus luteum to continue secreting progesterone and estrogen. This HCG will promote placenta. So here is your placenta. Right here is your placenta. This slide also demonstrates the detailed anatomy of the relationships of the fetus and the maternal blood. There's really no intermix between those two because there is a barrier in the placenta. So placentation is when the placenta is fully formed, and this is functional at the end of the third month. The placenta is where the baby gets its nutrition, its oxygen. It's also where the baby excretes waste products, and it's also an endocrine gland. It secretes hormones like relaxin, lactogen, thyrotropin. Okay. If the placental hormones are inadequate, this can lead to a miscarriage. And in medicine, miscarriage, we call it abortion just the same. Okay, we don't really necessarily use the word miscarriage in the clinics. So this is just showing you the different sites of implantation of placenta. So the normal placenta is right here by the fundus. Okay, oops. And you could see here in placenta previa implanting really low. This one is completely obstructing the cervix. This placenta, these types of placenta previa are high risk pregnancies and will necessitate a cesarean section. We cannot even do an internal examination if the placenta is right here because we can puncture that and cause bleeding and cause premature birth, premature labor. So organogenesis is a term that means production or development of the organs that at the 8th week age of gestation or age of pregnancy, all organ systems are recognizable, and that is also the end of the embryonic period. That's the beginning of the fetal development. So now we don't call it embryo anymore, we call it a fetus. And that's where you have a lot of growth of body structures Here is an image of a developing fetus at age 7. You could see at the end of week 7, sorry, week 7, not age 7. You could see that the limbs are completely forming. You have a large yolk sac right. You have a yolk sac right here, which is also, by the way, one of the hematopoietic organs of the embryo. Hematopoietic blood cells develop from the yolk sac. Here's your fetus at 3 months. All organs are very formed. You could see that there are 5 fingers on each limb and 5 toes on each foot. And then you have late 5 months, no? And Mariab, your textbooks provide you a table showing you the different highlights of fetal period. Like at 8 weeks, what happens? Um, you have the normal size right there. You have the cardiovascular system is fully functional. Okay, 9 to 12 weeks. Sex are readily detected from the genitals. You know. Blood cells starts to form. Okay. Developmental accomplishments, 13 to 16 weeks. That's about month form. You have sensory organs are differentiated already. The face looks more human, not alien-like. What else is there? Most bones are already distinct. 5 month, there's the beginning for the formation of the Pharynx caseosa. Caseosa means cheese. This is like cheesy, fatty secretion that covers the body, along with hair, very fine hair known as lanugo. Quickening also occurs mm, in the this month. Quickening is when the mother feels the first fetal movement. The first time the mother feels the baby move is what we call as the quickening. And some mothers, that will be their first sign of pregnancy. They miss the entire first 5 months because they're not paying attention to their body. And then we have month 6 and 7. You have the time of birth. Um, and we have a lot of technology now. This is an MRI showing you my granddaughter's first MRI 4 years ago. Okay, now let's look at the different changes in a woman's body during pregnancy. So if you zoom in on this, you'll see that the respiratory rate uh, increases because there's increased metabolism. In addition to that, the abdomen is being pushed up because of the growing baby, so that limits your lung capacity. So now you have to breathe faster. Volume of your blood is more. Diaphragm goes up. Again, faster respiration because of that. Urine production, not increase, but at the same time, the capacity of the urinary bladder is less. So that's why pregnant individuals go to the bathroom often. Um, Nutrient requirement is increased. Ligaments are softened. Breast starts to enlarge to produce milk. Nipples and areola darken. Not just the nipples and areolas, other parts of the body can darken too, like the face, the neck, the groin, the armpits. Uterus enlarges, of course. Navel is pushed out. The belly button is pushed out. And again, frequent urination. Just a few body changes. Let's look at, and those body changes are or could be signs of pregnancy. Not definitive signs, but certainly common in pregnancy. There's, of course, amenorrhea, which is the lack of menstrual flow. Amenorrhea. Basically, the missed period, one of the first signs of pregnancy. And there's also effects on the GI tract, like slowing down of peristalsis because of hormones. So constipation is actually quite common. And then there's purplish hue of the vagina. We call it Chadwick's sign. Um, We already talked about the breast enlarging. Cardiovascular system, blood volume is now almost half of your blood volume increases. Uh, Ligaments again relax because of that hormone. Urinary system, we said that. Weight gain, 28 pounds. If you remember in nutrition, we said that the weight gain is not just from the baby, because the baby weighs what, 5 pounds, 9 pounds? Hmm? The breast has weight, the uterus has weight, the bag of waters has weight. So that's the approximate weight gain of pregnancy. So let's see. Lordosis. Lordosis, if you remember in skeletal system, sway back posture. You have to sway your back forward to balance that the weight because of that enlarging abdomen. Right there. So this shows you the skin changes in pregnancy. You see here the mask of pregnancy. We call that melasma. You're gonna learn that more in your OBGYN classes. The linea, the line, linea nigra, the black line right here, the striae or the stretch marks. And of course, we have pregnancy testing, a sign of pregnancy. We're testing for the hormone HCG. If done too early, it may be a negative result. And if done too late, we said that earlier, it could also be a negative result. So, what are the other signs and symptoms of pregnancy? Well, we said quickening, the first perception of fetal movement. Now, pregnancy signs could be presumptive or probable and positive. Presumptive or probable meaning, you suspect pregnancy, but it's really not just the sole indicator of pregnancy. For example, abdominal enlargement is not positive, it's just presumptive because it could be fat, it could be just a weight gain, it could be a tumor. Frequent urination is only presumptive because it could be UTI. Breast enlargement, they're all presumptive. Even quickening is presumptive, no? Maybe you just perceive something. It doesn't necessarily mean you're pregnant. Maybe it's peristalsis. Okay? A positive pregnancy test is also presumptive. Why? Because I said earlier, testicular tumors and ovarian tumors can give you a positive HCG. So my question is, what then is a positive pregnancy sign, the most positive? We'll ask about that in class. Okay. So a few homeostatic imbalances. These are high-risk pregnancies. You will certainly see this, even if you're not going to be an OBGYN nurse, you're going to see this in the clinics. This is when there is insufficient placental blood supply. The fetus starves of oxygen. The mother has edema, hypertension, protein in the urine. Okay? So basically, it's almost like you're having an immune response to having a baby. We call that preeclampsia early on, and it can get worse and become eclampsia. This one requires, most often than not, this requires an early uh, delivery, if not early termination of pregnancy. Okay, so parturition is the medical term for childbirth. Okay, giving birth to a baby. The fetus determines its own birthday. Obviously, we can select the day that we want to be induced or we want to have a cesarean section, but we wait until the fetus, most often, we wait until the fetus releases oxytocin so that the placenta can produce prostaglandin, and that can initiate the contractions of the uterus. So, when is the time to call an Uber and go to the hospital? What are the signs of impending labor and delivery? I have it here on images. We have the rupture of the bag of waters. Honey, my water just broke. That's a sign of labor. Honey, I'm having contractions. That's a sign of labor. Okay. Bleeding, vaginal bleeding. No, your ninth month of pregnancy and suddenly you have blood. You don't say, "Oh, I have my menses back." That's not having your menses back. Vaginal bleeding is a sign of impending labor. And then the other one is cervical dilation. No? Obviously, this is not one that you can feel or see. This is for the doctor or the nurse to check. No? They check if your cervix has opened up. Like this one is open all the way, the baby's about to come out. So a fully dilated cervix is 10 centimeters. So here is your dilated cervix, 2 centimeters, 5 centimeters, and again our fully dilated cervix right here with the baby's head coming up. Um, these are the different stages of parturition. The dilation of the cervix, the baby is now engaged. The head is now engaged. In late dilation, the baby rotates. And dilation is even more completed. The baby is now expelled out and delivered. And then we determine the date, exact time of birth. And after the baby is delivered, there's also the placenta that needs to be delivered right here. So we all had a twin. Mm. After we came out, the placenta came out as well. So this is the I talked about it in our earlier lecture. This is an episiotomy, the perineum. Remember the perineum, this area right here? The perineum has been cut, and this is usually to facilitate labor, to help the baby come out, especially if the baby is big, and this could be the first baby. There's not much space for it to come out, that it might just tear off the perineum, so it's better to just do a clean surgical incision. This is cesarean section. So this is an artwork showing us that the cesarean section, let's see. Well, Caesar, Julius Caesar, the emperor of Rome, history told us before that he was the first one delivered through cesarean section because the queen was in distress and they wanted to save the baby, so they practically butchered the mom, Game of Thrones style, to take the baby out. But historians discover that that's not true. Julius Caesar was not born by cesarean section, but it was just during his time, his reign, that they started performing um, incisions on living women after death as a part of a religious measure to remove the baby from the womb. So this is an example of a breech baby. So it's not head first, but butt or feet first. This one is an assisted delivery, forceps delivery. As you can see, breech baby can also be delivered vaginally, especially if it's a small baby. They can come out vaginal. Now we have our newborn baby. We call that a neonate, and we can continue calling it a neonate up to 4 weeks. We assess the physical status in the first minutes of life. For us adults, it's vital signs when we check blood pressure, temperature, heart rate. But for babies, we call it the Apgar score. We have 5 criteria. We score 0 to 2 points each: heart rate, breathing, color, muscle tone, and reflexes. The highest score for a healthy baby is 8 to 10. Look at that APGAR. We actually can use the letters A, P, G, A, R to remind us what APGAR is, although APGAR is really a person. You know? So appearance is the color. So here's an example of how we score it. A score of 2 is a pink baby or no blue coloration, but a baby that is blue all over will be given a score of 0. P is pulse, which is really the heart rate. If the heart rate is more than 100 beats, that's 2. No heart rate is 0, and less than 100 is 1. G is grimace. We could read that. A is activity, baby moving versus not moving. These are the scores. And respiration, a baby breathing versus not breathing or struggling with breathing. And when you add it all up, you get a score of 10 for a perfect score. Next is lactation or breastfeeding or production of milk. The first milk that comes out of the breast is called colostrum. It has less carb, more protein, vitamins, and it's very rich with antibodies, and it provides passive immunity to our newborn. And it's released during the first days postpartum. Okay. Lactation is stimulated by continuous suckling of the nipples. So the more the baby suckles, the more you breastfeed, the more oxytocin you release, which means the more milk is going to be ejected. Okay. In addition to that, we know oxytocin also contracts the uterus. So you breastfeed, you also contract your uterus, which helps you shrink that large watermelon uterus so that it can go back to its avocado or pear size. It's one of the fastest ways to lose weight as well because when you breastfeed, you burn calories aside from shrinking your uterus. Now, this is a slide from one of a student presentation from 5, 7 years ago, and I borrowed it and I asked permission because she, in her presentation, talked about the symphony of breastfeeding. So she made this herself. This showed us the brown line. Let me change right here. The line right here shows um, birth, you know. So before birth, these are the levels of hormones for progesterone. What's green? Prolactin is preparing the breast for milk production. Progesterone, the glands are growing. Estrogen, the ducts are growing. And at the time of birth, these are the levels. This is what becomes of the levels of those hormones. If you look at oxytocin, each time that's basically showing us each time the baby suckles. So when the baby suckles or when the mother is breastfeeding, those are the levels of the hormones. So we now go to assisted reproductive technology. I would like you to pause this slide and read through this before you go to the next slide. Okay. So now I have a quick test for you guys, a matching type. Based on the reading from the previous slide, match the image with this uh, name of the assisted reproductive technology. So to help you, this looks like a needle going into an egg, almost injecting a sperm inside the needle. Um, right here, I'm talking about this image right here. And then this one, it looks like there's a plate here in the lab where an egg and sperm are introduced together, and then once fertilized, it's implanted into the fallopian tube. Meanwhile, this part right here, it looks like an egg is coming out of the ovaries and sperms are introduced directly into the fallopian tube. And this one right here, it looks like semen is being introduced through the vagina and into the uterus. So try to figure out which one is which in these letters right here. One that is not here is surrogacy, which is basically, I hope I said that right, which is basically implanting embryos in a surrogate mother who will host, whose uterus will host the embryos until term because maybe the biological mother is not able to or chooses not to. Okay, and the last two slides are this, and this one I will discuss in class.